welcome. Happy Love Data Week. We're so glad to have you here today. This is the second installment of our inaugural Love Data Week speaker series. Our theme this year is Spotlight on Open, and we're spotlighting 4 experts who work with open data in some really exciting ways. With these coffee chats, we're hosting Monday through Thursday this week, all at the same time, 1 p.m. Eastern. Then we're having a moderated panel discussion on Friday with all of our speakers at noon Eastern. Once I hand it over to Bob, I'm going to put the links to both of those things in the chat box if you haven't registered for our upcoming events yet. Before we start, I just want to go over a couple housekeeping items quickly. This session is being recorded and captioning is available. You will be sent links to the recording once it's been processed and uploaded. That can sometimes take a week or two, so be patient with us. Please do keep your microphones muted throughout. You may choose to turn your camera on if you prefer, but do remember the session is being recorded. You may end up on the internet. We do encourage you to use the chat to ask questions or raise discussion points at any time throughout the presentation or at the end. And I'll be posing your questions to our speaker after he finishes his slides. This webinar is hosted by the Research Data Management Working Group of the Network of the National Library of Medicine, which is an outreach and engagement arm of the National Library of Medicine. We provide free training, funding opportunities, and more nationwide. And you can learn more about us at nnlm.gov. As a companion to our series, we've compiled a list of 23 things about open data. These are fun tips, resources, and more that can help you learn more about open data and its uses. You can download the PDF of this list from the course pages for either the coffee talks or the panel discussion. And again, I'll put those links in the chat momentarily. The slides for our presentations are also available for download from those pages. Now, without further ado, let me introduce today's wonderful guest speaker, Bob Graddick. Bob manages and co-founded the Western Pennsylvania Regional Data Center, or WPRDC, at the University of Pittsburgh's University Center for Social and Urban Research. Launched in 2015, the WPRDC is a unique open data partnership between the university, Allegheny County, and the city of Pittsburgh. Bob is also a member of the Civic Switchboard Project, which is an effort dedicated to helping libraries and library workers become participants in civic data initiatives. So, Bob, the floor is now yours.
Thanks. Yeah, it's good to be here and be part of this today. So what I'll do is I'm going to really just use this time to tell the story about the work that we've been doing here in Pittsburgh with open data related to the pandemic, and talk about the wonderful work that a lot of our partners are doing with this data too. So with that, I'll just take it away and start by that's my talk title. So start by just giving you a little bit of background about the work that we do. So I work at what's called a civic data intermediary. And our community of practice is actually organized through the Urban Institute called the National Neighborhood Indicators Partnership. So it's been around for well over 20 years. And it's a network of over 30 other communities that do this work. And so our goal is really to assemble, transform, and maintain data. My dog is barking in the background. You can disseminate information and apply the data to achieve impact. And then we also use this data to strengthen civic capacity and governance. So all of our partners all around the country are doing this. It's a wonderful community to be part of, and we learn so much from being there. And so a little bit about the project that I manage. It's been around since 2015. And as was mentioned, it's a partnership with the city and the county here. We maintain an inclusive open data infrastructure. We have over 20 different organizations publishing data. Our 2 biggest publishers are our partners at the city and the county by far. We also build a lot of tools to share data. We help automate a lot of publishing processes. We provide a lot of technical assistance to different people in our community and our ecosystem. And then we also do a lot of work to build data literacy too. And my colleague Liz Monk is taking the lead on that with work she's doing here with local libraries. But just to ground the conversation a little bit, just want to clarify this definition of open data. And so when we talk about open data, we talk about machine readable data, no cost to access, minimal restrictions on use or reuse. We also talk about complete data sets and data that is low risk of harm to people. So generally speaking, most of the data we have doesn't have personally identifiable information. We take a look at everything that goes up, and librarians have been a really big important part of that work, just making sure that we get it right. And we're also really part of some great partnerships here in the region that really got rolling with the pandemic. So the Black Equity Coalition is one that I'll talk a little bit about. And that's a group of researchers here at the University of Pittsburgh and Black community leaders, really just trying to put together a strategy for the pandemic in communities that have been historically marginalized. And then the Neighborhood Resilience Project is also one that has a whole network of community health deputies out kind of knocking on doors and being, you know, the primary point of engagement for a lot of people in a lot of communities. So we're really blessed to have that kind of partnership here. So with that, I'm going to move into more of the data story. And everybody has seen so many dashboards during the pandemic. They're everywhere. But really, I think the thing that I would advocate is people publish more open data about the pandemic. And I'll talk to you a little bit about what we've done here. But you know, when you just rely on dashboards, the view of that pandemic is mediated by the designer. So they're making the choices, they're reinforcing the power dynamics if they're a person in power. They're letting you only view that pandemic through their own perspective. And so that's a real problem a lot of times, especially if you're trying to work in a lot of the communities that we're trying to support. These dashboards also provide data and present it free of context. So just with the example of what you see here, the screenshot I took from Pennsylvania, you know, it shows a lot of demographic detail about the population, but it doesn't really give you background on, you know, how many or what the racial breakdown is or the age distribution is across the entire population. So that's a challenge. Another thing that happens is users really don't have a sense of how to take action. Looking at this, you're like, okay, this is good to know, but what do I do? And you know, that's a real challenge too with dashboards as well. You know, they could, and I've seen other efforts to really think about indicators of the pandemic that look at, you know, how long it takes for results to come out. Are the number of tests adequate? None of that stuff is presented here. And, you know, a lot of the work that we do is really trying to support decision makers. And I'll show you some examples of what we've done there. And just having the dashboards just really presents the illusion of transparency. You're not giving people access to the raw data so they can look at it in ways that they want to look at it. You're just kind of presenting your own view of this. So dashboards are great in terms of a decision-making tool, but if you're not backing it up with open data, it can be a real problem. So the work that we've done with the Equity Coalition primarily really started with research. We wanted to know more about the kind of questions people were having about the pandemic. We had to learn a lot about the systems that were in place, producing the data that we were hoping to get access to. So we did a lot of research into the electronic death registration system here in Pennsylvania. We looked at the CDC case investigation report format to get a sense of what kind of data might be available. We looked into the PA-NEDS disease surveillance database and what was created there. And we interviewed people all across the state that manage these systems just to see more about what was in there and what the quality was like and the quality issues we might run into and the biases that might be in that data and what might be missing. So all that research was really important in helping us understand, you know, how to formulate data requests. And so we helped the members of our coalition actually make those data requests themselves, because I think it was really important that they be out at the front of this work. And, you know, the questions that they had were, you know, how's the spread of the virus changing over time? So we wanted to be able to look at time series data. What were the spatial patterns of infection? Could we look at community by community trends over time? Which communities and populations are most affected? And is testing equitable? So those were just some of the initial questions that we came up with. And they put the requests in. We then worked with our county partners who get an extract of the different data sets from the state. And we helped to automate that availability. We made sure that no personally identifiable information was there, you know, especially names. But we do get a daily extract of the PA-NEDS, the disease surveillance database. So we could start to do things that were really interesting, looking at different population dynamics. We maintain those feeds every so often. They'll break, or if there's a big caseload, the publication time gets a little bit longer. We make sure that that data shows up as soon as we have it. And then we started to acquire and maintain a lot of other relevant data related to social determinants of health as well. So looking at things like mortality over time. So we made a lot of other ancillary data requests around this too. And then the other thing too, from all that research and all the conversations we had, we thought it was really important to make sure that we put out a guide for other people that wanted to use this data. There's a lot of people, that want to just know more about, why, for example, in Pennsylvania, a lot of deaths have been showing up 3 to 4 weeks after they actually occur. So we wanted to be able to anticipate and answer those questions through a guide, kind of relay back the kind of challenges that are in place with a lot of those systems and system adoption. And we also wanted to let people know where those biases might be in the data and what might be missing, what might not be captured in the data that we do get, or the data that the state is putting out through some of their dashboards too. And so that's up on our site. And so once we had those data feeds established, working with the committee and the data committee, the data subcommittee of the Equity Coalition, we meet twice a week, and we have pretty much since April. And our partners that are part of the coalition in Carnegie Mellon's Create Lab, they built a really nice dashboard that looks at a lot of the equity dimensions with the pandemic. And then we'll kind of talk about this and use this as a really nice touch point to say what's happening based on what we see, is our cases rising in a certain group, what can we do about that? And so some of the actions that really kind of came out of these conversations were, the decision to really focus on federally qualified health centers is a real community resource around testing and, bringing case investigators into the FQHCs to make sure that there was a lot of cultural competence in talking to people about the pandemic too. And, advocating for testing at locations that were convenient to a lot of the people that were most exposed or most at risk of exposure. So a lot of the data that we look at kind of leads to a lot of the activities and actions that a lot of other subcommittees in the coalition have taken. And looking at all this, we started to ask more questions. So, in Pennsylvania overall, one of the things that we noticed was at least 40% of the cases don't report race, and we wanted to learn why. And so we worked with our partners at Allegheny County who had access to, the detailed data that comes out of the state systems to say, are there differences across providers or labs? And we found that there were. And so working with the state health department started to, members of the coalition really started to have conversations about how do we get all providers doing the right thing and reporting race and ethnicity and all the testing data that they're collecting. So a lot of work went into that and understanding that. We had names of providers that were and weren't doing the right thing. And then we also got access to case investigation data too that a lot of the county staff were collecting. So just to get a sense if there were differences across race in terms of exposure and transmission. One of the things we did with the community health deputies with the Neighborhood Resilience Project was we did a lot of data literacy work. So we took the dashboard and trained a lot of the community health deputies, the people that were out on the streets every day, just making sure that people knew how to keep themselves safe. We brought the dashboard to them. We explained a lot of the information in the guide in kind of more visually friendly ways you could see there. So just what is a case investigation? What happens? How long does it take for results to show up from the lab? All those kind of questions we were able to answer and then give people practice actually using the dashboard that we put together with members of the Black Equity Coalition. And so our focus now is really on making vaccine data open and available. So it's the same process, just kind of researching the systems behind the data, starting to get a sense of what happens within the state's immunization information system. How does that work, and how does that interrelate to a lot of the information about how vaccine shipments and manufacturing has happened? So we're still learning a lot about that. We actually put together a lot of questions that we were getting from people about vaccines and shared those with people at the state, and shared a data request with them recently too, just to start to get more and more detail about vaccinations and how many people are vaccinated and what we can learn about some of the biases in the data around race and ethnicity. We're seeing the same patterns appear though in this data where there are just a lot of unknowns, and we want to start to understand more about how to capture better quality data with that too. So stay tuned. Some of the other work that we were doing last year was around the Census 2020 outreach efforts too. So um, we proposed putting together an asset map because there's so much data about deficits, but if you're talking about how to reach people, complete the census or to go and get tested or take a vaccine, trusted voices and trusted institutions really matter. And so what we wanted to do was pull data out of a lot of the data that we do get, the administrative data like restaurant inspections or weights and measures inspections that inspect scales and gas pumps and things like that, and pull that out and make additional data requests to the state, for example, for barbershops and nail salons using professional license data. And so we were able to get all this together just at the time the pandemic hit. But we were able to use this data to start to understand more about, okay, if we're working in communities, how can we share information about some of the resources that are there, some of the people that might be trusted in the community. And we put this all together as a map that is publicly available along with the open data behind it. So we linked together like 30 different data sources to put this thing in place. So we're really proud of that work. And I also mentioned, you also heard that I'm part of the Civic Switchboard project team. And so this is an IMLS supported effort. And it's really all about developing the capacity of academic and public libraries and civic data ecosystems. And so one of the things that we've done is to develop a toolkit and a guide for libraries that are really interested in expanding their role. And one of the things with the pandemic that I thought was really interesting a few weeks ago, you might have seen what was happening out in Philly on the other end of the state, where there was a Philly Fighting COVID effort of kind of volunteers, and then it turned into a for-profit operation and a whole mess around a vaccination clinic that they had. But one of the librarians at Villanova actually noticed that there was no privacy policy on the website sign up for vaccinations. And so she started to ask questions, and having people with those kind of skills and experience really involved with civic data efforts will lead to people having their privacy protected or having more data available in useful ways. And so just that gets us back to the library roles. So these are some of the roles that we've identified in through the Civic Switchboard project. We funded a number of small scale projects and done a lot of interviews and had conversations with people working with civic data and their different ecosystems as library workers. And so these are some of the roles that we've been able to identify, everything from connecting people. So it's kind of libraries as an intermediary in that role. Building literacy, showing the importance of civic data to people, being a cheerleader, making data more usable, providing expertise to local governments and other organizations around data management, helping people use and publish civic data in ways that make it easier for people to find it, and then kind of thinking about archival data too. And so with that, I'm just going to leave time for question and answer. And this is a picture of a representation of Carnegie Libraries, Andrew Carnegie mascot. So this is our public library here in Pittsburgh. So with that, Kelsey, if you want to throw some questions my way, and I'll take a look at the chat too.
Yeah, awesome. I don't see any audience questions in the chat yet, but please do type those in. But I have a question for you to kick us off while some folks type their questions in. I'm curious to know, are there other regional data centers similar to yours around the country that our attendees might be interested in learning more about in their area?
Yeah, so that, we're kind of a unique one, or at least when we kicked off, kind of operating outside of government. A lot of times, like what happens with open data efforts is the government will hire a vendor and they'll set up a repository and it will just be one organization. But kind of the model for us that we looked at was Open Data Philly. It wasn't a repository, but it was more of a community-wide data catalog with links, federated links to other data sets. So that was one we looked at. And since we've been at it, I think a lot of people have found our model. And I know St. Louis had launched with their Regional Data Alliance, I think is what it's called. But they're trying to do the similar thing that we've done, is kind of, provide this data infrastructure outside of local government so that people can, it just makes it a little bit safer, more resilient. So, that's just like one of the communities. We've talked to a lot of other people about this kind of model as well. So.
Awesome. Well, there are still no audience questions, and I have another question. So
Yeah.
I'm just going to keep peppering you with questions.
Oh, feel free. Yeah.
So it really sounds like you and your partner organizations really done some important and really excellent work, especially in relation to COVID in particular. As we start to think, maybe a little bit optimistically, it seems, but about a post-COVID world, to what extent do you think this work and these partnerships that you've established are going to be providing a framework for future work around open data and community health? Where do you see this going?
Yeah, I think these are all, we've had a lot of these relationships for a long time, but it wasn't until the pandemic hit that we've all like really come together and started working, in a joint fashion. So I think it's going to continue. We've talked about like other focus areas around health equity more broadly, whether it's access to medical care or, we have a lot of issues with lead in a community with such an old housing stock and old plumbing and things like that too. So we're going to try to tackle a lot of these issues that we've dealt with in a more systemic way. So our role in that is going to be to help people that are leading the effort be able to find and access and use data in that kind of work.
Awesome. Great. Some audience questions. How is the WPRDC funded?
Yeah, so that's a good question. So it's changed over time. So we were fortunate to get the support of two of our local funders to really get us going. And so together we worked with the city and the county to actually get support to build not only our project, but also build out data teams within the city and the county. There wasn't this kind of central data capacity in any of those organizations. So we were fortunate to kind of get bootstrapped for the first 3 years or so with that. So we really tried to be mindful of where we were spending our money. We really wanted to rely on open source technology and things like that so we could pay people on our staff instead of paying a vendor. But once those 3 years were up, we had to figure out like, okay, now what? So we were able to put a contract in place for annual support from the city and the county, which is about a quarter of our budget. And the rest of it we have to come up with, and that involves partnering with other researchers here at the university and other universities on research projects, partnering with either nonprofits or going back to the foundation community for project-based support, doing things for national audiences too. So for example, I'm working with the DASH program through Robert Wood Johnson as a mentor, and so that pays for part of my salary. And so those kind of opportunities are out there, just trying to do small grants and partnerships and just kind of fill the budget as much as we can in those ways. But just having that dedicated support from the city and county is really nice to have.
Awesome. I think both of the questions were actually about funding, so I think you answered both of them at once.
Yeah, and if anybody needs more detail on that, like please reach out. We do weekly office hours, and I can, share some more materials about kind of our whole startup operations and how we are right now. We didn't really have a plan in place around long-term funding when we started. We just wanted to get the plane off the ground and in the air and then figure it out. So that's why having like a really long runway of 3 years was nice, because I know a lot of places just didn't have that, and they're like, oh, how do we get this funded? And I'm like, you don't quite know what you are yet. Well, I don't know what to do. Do we have work or plans to work on food access, nutrition issues within our community partners? Yeah, that's actually a conversation we've had with a number of organizations. And one of the challenges we have is people will kind of start these data efforts and initiatives and not really reach out to us. So, one of the things we've realized we need to do more is just be out there and kind of be more visible. So the local food policy council is a coalition of organizations related to, food access, nutrition. And so we're talking to them about like working together on projects and proposals and things like that. So I think like what we've learned is this kind of collaborative approach to data really makes sense. Working together with an existing community and just kind of plugging yourself in there as a resource, as a part of the team, as opposed to like letting them do the work and figuring out, okay, what kind of project can we do together without having been there at the start to kind of figure out what data sources are there, what kind of needs the group has. That's really important. We're trying to build that more and more into the work that we're doing and have conversations with our funding community about, maybe is there a way that we could just kind of engage and figure out the projects as we engage, as opposed to, thinking about projects as a standalone thing.
So there's a comment in the chat saying, you mentioned the risk of dashboards providing biased curation of data, which made me think about the infamous Florida dashboard and the police raid and safety and risks to people supporting open data initiatives. And that made me curious. Obviously, you haven't experienced any police raids, but what sorts of challenges have you faced with this? Have you gotten any pushback, or has it all just been smooth sailing?
With this, I think it's been pretty smooth. I think there was at least the initial push for open data. Everybody was like just busy trying to figure out what they were doing back in the spring. So like we didn't really get access to the open data until August, but it was like built on a lot of really good, strong partnerships. So I wasn't worried that we would eventually get it. I think just the nature of this, like everybody just not knowing what was going on and the need to build trust across organizations and people, like that took time. So I think like that was one of the challenges that we faced. But I think now that, we've built these really strong partnerships in our community, and our partners have built really great relationships at the state level, like it was a lot easier for us to make the data request for vaccine data and just kind of engage people there. So, this stuff it's all based on trust, and it works at the speed of trust. And, you just have to be patient sometimes, but know when to push and who to push. And really, it's good to have allies and partners that you can have make the data requests instead of just you, the data person.
Awesome. Well, we have no more questions, but a couple minutes left. Is there anything else that you would want to share with your remaining 2 minutes or so?
Yeah, I think like if you're interested in getting plugged into this more and more, if you're at a library, like there are a lot of people that just don't know what you can do. And I think the Civic Switchboard is a really nice way for us to kind of tell the story about Pittsburgh in a bigger way, and kind of make it more of a how-to for a lot of other libraries. So I think what we learned, like just with our work, like we didn't really know a whole lot about metadata or the importance of it until we met the metadata librarian at the university. We used our librarians to help us figure out exactly like what the pluses and minuses of the different data repositories were that we were looking at, and they had been involved with our search committee. We have our librarians interact directly with our city and county partners anytime a data privacy question pops up. So I think like there's definitely a role that libraries can play. If you don't know what that role is, I think like take a look at a lot of the Civic Switchboard materials there. We have information about how to connect with some of your local partners too. But there's a real need for your skills out there. And I think just people don't know that you can do the things that you do.
Awesome. We are right at the end of our session. So huge thank you, Bob, for coming and chatting with us today and answering all of the audience questions, my questions. I really learned a lot. It was really exciting. If you have more questions, folks, bring them to our panel discussion on Friday. I will drop the link to that in the chat again. And I'm going to go ahead and end the recording. And I hope you all have a great rest of your afternoon and rest of your week.
Yeah, thanks, everybody. Appreciate it.
Thanks for watching. This video was produced by the network of the National Library of Medicine. Select the circular channel icon to subscribe to our channel, or select a video thumbnail to watch another video from the channel.